Thank you, President Frank. Well, Bob wanted me to talk a little bit about health and the Health Sciences Center and perspective that connects, obviously, with this conference relating to economic development. Well, first of all, at a national level and a principal level, if you have a healthy workforce, you're going to have a more productive workforce. And also, employers tend to look to communities that have good access to health care as a marker for determining where they're going to be based. And when you look at some of the provisions of the Patient Protection and Affordable Care Act, somehow the patient protection part got, fell off, and now we're only referred to it as the Affordable Care Act. And what that impact might be on businesses, there are both positive and negative elements that relate to the ACA, but access to wellness and prevention and comprehensive health care for the employees is probably at the top of the positive list. Within healthcare, there are really two sectors. There's the healthcare delivery industry, and we've had lots of discussions around the biotech and the biomedical industry. At the state level, New Mexico's healthcare delivery industry's total contribution to the New Mexico economy is $15.2 billion a year. And the industry employs over 85,000 people. There's about 4,500 physicians in New Mexico, 40% of whom are our graduates, many of whom are in private practice. And for each private practice, it's estimated that there's about $1 million that contributes to the local economy. Healthcare industry in central New Mexico is seeing significant growth and will probably continue to see growth for the foreseeable future, even in the worst months of the recent economic downturn. And given the Secretary's comments about the impact of the federal dollars and government public funds going down, regardless to that fact, the fact is healthcare will continue to grow. It's one of those industries that have been growing and will continue to grow. When you think about what's going to happen over the next few decades, people will still have babies. So if you want to get into a good field, try obstetrics. There's very little that politics or economics are going to do to impact the fact that when you have a married couple, they're going to want to have kids. So populations will continue to grow. And when you take a look at the demographics, which population do you think is going to grow the fastest over the next decade or so? It's going to be people that are about my age. The baby boomers will be the largest segment of population growth, and particularly in New Mexico. And as we all age, there will be greater need for health care. It's estimated that 80% of the health care dollar happens in the last decade of life. So there will be a significant and greater need for outpatient services. There'll be a greater need for inpatient beds. And a particular area of health care that we are researching here in our institution is determining more efficient methods for management of chronic disease. In this country, we don't do a great job on managing people who have multiple organ system failure. Chronic diabetic with congestive heart failure, with high blood pressure, with renal failure. The needs of that particular individual and the impact on that person's family is incredible. We don't have a great way of managing it. Big expense. We've got to do a better job in determining how do you manage a growing population that will fit that definition in a way that is less costly and more effective and will result in a higher quality of life for that person. So at the Health Sciences Center, we're implementing strategies to help address this increase in demand. And it's a three-part plan. First of all, we're increasing our class sizes in our health professions. In our nursing, pharmacy, allied health programs, and medicine, we've increased it by 30%. We're exploring ways to reduce waste and increase efficiency in a special area of research that's called health services research. And then finally, we have many projects underway to increase our capacity as a healthcare delivery provider to provide highly specialized care that simply isn't available anywhere else in the state. And so we currently have a project we are hoping will be approved shortly that will allow us to build a 96-bed adult hospital. When we talk about jobs, Mr. Secretary, we're talking about 200 more New Mexicans that will have jobs during the construction phase of that facility. It'll employ over 300 health professionals. This is a new job, a new sector for to address some of the economic problems that we face in this state. Not only that, but it will actually help us address some of the capacity problems. This is a human issue. This is beyond politics. Who recently has had the chance to visit our emergency department in the last 6 months? I apologize. First of all, I'm sorry that you had to go to an emergency room, and I'm sorry that you had a wait, a long wait. Our diversion rates for our emergency department to get admitted to our hospital have skyrocketed simply because we don't have beds. We are significantly behind the power curve on this. New Mexico is way underbedded, as we call it in the healthcare industry, given the size of the population that is only going to increase and disproportionately require additional services. So let's put the healthcare industry delivery system piece aside for the moment. Let's talk a little bit about the biomedical industry. This industry is very scientifically driven. It's highly entrepreneurial. The biotechnology segment has generated and commercialized a wealth of innovations emerging from basic scientific research conducted in leading research institutions like UNM, and represents a highly successful example of technology transfer. These innovations today are at the interface of biology, computer science, engineering, and advanced materials. In the context of today's summit, and while recognizing the really interesting metaphor of the rainforest and the sociological aspects that have been described so far, the phenomenal success of Silicon Valley, there are also, looking at it another way, there are 4 general ingredients that made Silicon Valley successful. First of all, it was a home of a lot of really well-trained engineers and computer scientists. There was this critical mass that was sitting there, just like Albuquerque. There was a climate, though, of no-fear entrepreneurialism. Not sure that we're really there today. There's a lot of apprehension. As the Secretary mentioned, as we've discussed in other forums, there's a lot of anxiety about the future of business. Thirdly, there was the availability of capital to back new ventures. We're trying to find those dollars. And then finally, there was an accommodating government policy. Those were the 4 ingredients, along with the sociological elements that contributed to the success of Silicon Valley. Those 4 ingredients were essential. We can do that. We can do that in Albuquerque. So I applaud President Frank for identifying many ways in which UNM can help address the economic development needs in New Mexico and in central New Mexico, working in partnership with local government and the Chamber of Commerce and the state and the business community. We can achieve these things. Computers are made of silicon. Life is carbon-based. The Rio Grande could become the Silicon Carbon Valley for the future. Thank you.